What's up, guys? How's it going? Cade Moore with More Muscle, and today we're going to be talking about asthma. Guys, I've had lots of friends with asthma, and I had one friend in particular. They lived in Washington for most of their life, then they moved to Utah, and when they moved to Utah, due to the pollution and the allergens and the dry air, this person got really bad asthma. And a good friend of mine, and it's very tough to have asthma. But anyways, guys, let's get to it. Asthma, guys, it's a chronic childhood inflammatory disorder, and basically you're having an immune reaction where your body thinks there's something harmful going into your body, and it releases histamines, and your throat can close. It can cause excess, mucus production, and it can cause some serious harm if not treated correctly. But the good news is there are lots of medications and lots of remedies that can help with asthma. So we're going to go and get started, guys. So asthma is a chronic childhood inflammatory disorder of the airway that results in intermittent and reversible airflow obstruction of the bronchioles. Your airway may narrow and swell and may produce extra mucus. This can make it difficult to breathe. It can trigger coughing. It can cause a whistling sound or stridor, and this can also cause shortness of breath. And now, guys, the airway is so critical and it's so important. If the throat closes off and you can't get oxygen, that can be fatal, and that can be a medical emergency, and could even cause potential serious problems. So this is the leading cause of hospitalizations among children. Mast cells release histamines, which cause inflammation. So your body is basically saying, hey, there's something going in my body, whether it's an allergen or whatever it is, whatever you're allergic to or whatever you have asthma to. Your body's saying, okay, I don't want this in. It could harm my body, so I'm going to release these histamines that can protect my body from these allergens or whatever they have asthma to. Allergies, and asthma go hand in hand. If you do have allergies, your risk for asthma goes up. So allergies and asthma, they go hand in hand. So intermittent, there's a couple different levels of asthma. There's intermittent, mild persistent, moderate persistent, and severe persistent, guys. So for some people, asthma is minor and it doesn't really bother them, doesn't impact them at all. But for others, it's a major problem, and this can interfere with their daily life, and they can have constant asthma attacks. And also, guys, some people, they do outgrow asthma. When they become an adult, they can outgrow that asthma. So let's get to it. Asthma can be controlled, but sometimes it cannot be cured. You can work with your doctor or a medical professional to get the treatment you need. Some risk factors include family history of asthma or allergies, male sex until adolescence, then it is greater among women, exposure to tobacco smoke, low birth weight, being overweight, having allergic conditions. Guys, like I said, when you have allergies, you're more likely to get asthma, such as dermatitis, reddish skin, hay fever. Guys, that's like you can get that in the spring or summer. I get that really bad. Luckily, I have no asthma, but that can cause congestion, itchy eyes. And another thing is secondhand smoke is another risk factor. Exposure to occupational triggers such as chemicals used in farming, hairdressing, and manufacturing. Some triggers to asthma include mold, cockroach antigen, dust mites, outdoor grasses, pollen, trees, shrubs, molds, spores, air pollution, weeds, tobacco smoke, wood smoke odors, sprays, exercise, cold air, or changes in the temperature, environmental change, infections, animal hair or dander, Medications such as aspirin or NSAIDs such as non-steroidal anti-inflammatories such as Tylenol, antibiotics, beta blockers, strong emotions strong emotions can cause asthma. GERD, which is gastroesophageal reflux, food allergies, endocrine factors such as menses, pregnancy, thyroid disease. So guys, there's a lot of causes for asthma, and you want to basically figure out what you're allergic to or what causes that asthma, and you want to get rid of that. You want to stay away from that. If it's something like hay fever, that's very difficult to get rid of, because you can't really not go outside. So, anyways, expected findings: you could find chest tightness, asthma exacerbations, onset and duration of the asthma. Changes in medication can cause it. Medications that relieve the manifestations. So if you give a medication for asthma, that asthma will go away. Other medications, self-care methods, home school environments, heating and cooling sources at home. So some symptoms, guys, that would be shortness of breath, cough, audible wheezing, lung sounds, wheezing, mucus production, restlessness, anxiety, sweating, accessory muscles, decreased oxygen, sitting retractions, inaudible breath sounds or crackles, and trouble sleeping. So guys, there's different types of asthma. There's exercise-induced asthma, which can be worse as the air is cold or dry. There's occupational asthma triggered by workplace irritants such as chemical fumes, gases, or dust. And there's allergy-induced asthma such as airborne substances such as pollen, mold, spores, or particles of skin and dried saliva shed by pets. I've worked with a couple people with the occupational asthma, and luckily, if you're working in an environment that you're breathing in things that can cause the asthma, you can get rid of that. And then, guys, so for the labs, if you want to know that if you have asthma, you're going to look for an increased WBC. WBC is white blood cells. This is like the immune system. Whenever you're sick or you have an infection, your white blood cells are going to be above 10,000. So the normal range is about 5,000 to 10,000, and above 10,000 indicates that your body is fighting something. In this case, asthma, you're fighting something that doesn't actually do harm to your body, but your body thinks it does harm to your body. And then you'll also see a rise in eosinophils, hard word to pronounce. And you'll see a rise in those. That also indicates an allergy. There's diagnostic procedures like how to diagnose asthma. And there's basically the most accurate test for diagnosing asthma and its severity would be like, sorry, I don't remember what I wrote here. Okay, but there's the peak expiratory flow rate that can basically tell you how well you're breathing. You can use the flow meter, and this is gonna show you how well you're breathing, and if it's in a low range, then it can cause harm. There's bronchoprovocation testing, methacholine, cold air or histamine exercise challenge, and there's a skin prick test that identifies your allergies. I actually did this because I do have allergies. I get hay fever, just because Utah has really dry air, and I get hay fever, and the seasons constantly change, so I'm allergic to pollen. So what they did is they got a bunch of things that I could be allergic to, like dogs, stuff, and they poked me with it, and then they waited for a couple minutes, and they saw on my skin which ones were reacting. And a lot of it was the allergies, like from tree. I had no allergies to dogs or pets. I just had allergies to pollen, and that helped me identify what allergies I had. And guys, this is also a recommendation from me, but if you do have allergies or asthma, I would go to an allergy and asthma clinic, and for me, I don't have asthma, but for my allergies, they give me a shot of what I'm allergic to. And this has completely changed my life. I used to get allergies every spring and they were terrible. I just felt tired all the time. And I went into this allergy and asthma clinic and they basically did the skin test and now they give me a shot every couple weeks of what I'm allergic to, and eventually your body just says, hey, I'm not allergic to this anymore, and you don't have a reaction. So it's the best thing ever. Obviously there are some precautions. You could go into anaphylactic shock where that allergy can cause you some problems. So you want to make sure you're supervised by medical professionals and obviously do what's recommended, and but this might help you. Anyways, guys, chest x-ray can show if they're having asthma, like they're having hyperextension, or if there's any infiltrates. And then for nursing care, guys, you want to assess airway, you want to assess respiratory rate and how they're breathing, assess breath sounds, monitor for asthma symptoms such as shortness of breath, monitor vital signs, check the blood count and x-ray, position child to maximize ventilation. So usually if a child's sitting up, they can maybe breathe better. So you want to just see how that child can breathe best, and so that how they can breathe best, and you want to get them in that position. Administer oxygen therapy, and you want to have intubation near, guys. So intubation is basically a tube that goes down your throat and it will help you breathe. So just in case their airway swells too much where they can't breathe, they'll need that. So they can have that constant air, that oxygen, and those cells can get oxygen. You want to make sure they have IV access in case you have to administer antihistamines or some type of drug to help their body with the asthma. You want to maintain a calm and reassuring demeanor. So guys, I want to make sure it's maintain a calm and reassuring demeanor, but you don't want to ever lie to a patient. You want to be calm and reassuring, but you never lie to a patient. I want to remember that. You want to encourage appropriate vaccinations and teach family and child about when to use prescribed medications. So guys, some medications, let's go over it. There's bronchodilators, which is a SABA, which is short-acting beta agonist, such as albuterol, levobuterol, and terbutaline. That can help with asthma. There's LABA, or long-acting beta agonist, such as formoterol, salmeterol. These can prevent asthma at night and long-term. Anti-inflammatory therapy cannot be used to treat acute exacerbations. So do not use anti-inflammatory therapy for acute exacerbations. You want to use short-acting, the SABA, or like albuterol. Cholinergic agonists block parasympathetic system and provides relief of accurate acute bronchospasms. So that's going to prevent asthma. Monitor for irritability, tremors, insomnia, and nervousness while taking this medication, and administer before exercise. Now you can take anti-inflammatory agents that can decrease airway inflammation. Corticosteroids monitor growth. Leukotriene modifiers decrease airway resistance. Mast cell stabilizers help with long-term control. Monoclonal antibiotics for severe allergic reactions. Theophylline is a stimulant that requires frequent blood levels, and this can help. Magnesium sulfate used for severe attacks. You can administer IV or in the emergency room or ICU. And then after, you want to make sure this patient's doing rehab, they're doing respiratory, and they're getting nutritional services. And you want to identify personal trigger agents. So if they do that skin test, you want to make sure they know what causes it so they can avoid triggering agents. You want to provide family and the child with asthma action plan. Show them how to properly use medications if you are a medical professional. Perform infection prevention, good nutrition, and good hand hygiene, reduce allergies, and keep up on immunizations. Guys, the reason it says perform infection prevention is because some of these medications can actually lower your ability of your immune system to fight off diseases. So it's important to monitor if there's an infection because, like I said, some of these medications will lower your ability to fight off infections. So if you do get an infection, it could be very serious. So complications, that's status asthmaticus. So that's when there's a life-threatening episode of airway obstruction that is often unresponsive to common treatment. So you would see wheezing, labored breathing, nasal flaring, tachycardia, which is a fast heart rate above the normal range for adults is 60 to 100, so it would be above 100. You want to monitor for oxygen, position the child upright or adult upright, administer humidified air, administer medications, obtain IV access, maintain blood electrolytes, administer corticosteroids, and prepare for emergency intubation. You can always, like I said, you can always administer magnesium sulfate if you must. You want to monitor for airway resistance, and you can you can actually administer ketamine, which is a muscle relaxant and can decrease airway resistance. Respiratory failure, you want to monitor for that, and you want to monitor for O2, and you might even want to have that intubation stuff nearby. And then for the peak flow rate, guys, basically you'll blow into this thing, or I don't really know how exactly it works, but the green is 80 to 100%. That's good control and follow a routine plan. If you're in the yellow, which is 50 to 79%, this could notify you that you're having an attack soon, and you want to make sure your healthcare provider knows. And if you're less than 50%, that's emergency action, and you need to use a short acting bronchodilator and notify provider if there's no improvement. So this is kind of neat that if you do have asthma, there is this thing that can help you check to see how bad your asthma is doing, and if you need to go to the medical doctor, or if you need to go to the emergency room, or if you can just hang out. So anyways, guys, thanks for watching. I feel terrible for anyone that does have asthma, and I wish the best for anyone that has asthma. It's a terrible thing to go through, and I feel for you guys, whoever has it. But there are plenty of ways medical professionals can help you. So anyways, guys, thanks for watching.